everyone, welcome to my channel. My name is Belita Savage and I'm a nurse practitioner here in London, Ontario. Sitting in this beautiful sunlight, I thought I'd just show my face in a different light. I'm just loving this glow. So today I want to talk to you a little bit about what hyaluronic acid dermal filler is and what it can do for you. So hyaluronic acid dermal filler is a type of filler that is used to help augment areas of your face, neck, hands, to create volumization in areas that we feel have lacked volume or require more volume due to the aging process. So as we get older in our bodies, we are creating less hyaluronic acid. You can just see that there's just more shadowing, hollowing in the face that a lot of us don't really like as we get older. Unfortunately, that is the process of aging, and there are ways to help combat those signs of aging. Technically, hyaluronic acid dermal filler is an implant, a temporary one, and we can use them in areas of the face to help volumize, give you more structure, give you more of that contouring, especially if you're somebody who's looking for that nice cheek line, or if you're looking for that lower face augmentation, more like of a straighter jawline or a stronger chin. We can do a lot with dermal filler, and I love hyaluronic acid dermal filler. That's something that I love to do every single day. So as we get older, there's a lot more shadowing that starts to occur. So with hyaluronic acid, we can use these syringes of filler to go into those areas and actually help fill and augment so that we decrease the amount of shadowing that is seen within the face. I, as an injector, feel like it's super safe to use. We all have vessels and arteries and veins running through our face, throughout our body. That's what keeps us alive. So yes, it's dissolvable. The one product that we use is called hyaluronidase. It's a medication that we can use to help dissolve the hyaluronic acid if it gets into a vessel. So one of the complications that we do inform patients is that it can actually lead to a vascular occlusion. And that's when essentially your hyaluronic acid dermal filler gets injected into a vessel, so like an artery or a vein, it blocks the blood flow and it essentially damage your tissue. It can kill your tissue over time. Time is of the essence. It's not something that you want to be leaving alone for hours or days. You want to have that managed by your injector very quickly. Hyaluronic acid dermal filler, there's different types of gels. So you can have thin gels and then you can have thick gels. The thicker the gel, the longer it's going to last. We use the thicker gels to help augment or create more structure in areas like the cheeks or maybe the temples or in the chin or in the jawline. These are areas that are structural for us. When you're looking at other areas of the face, like under your eyes or within the lips or around your lips, which is the perioral region, if you're looking at your hands, you want to fill, or even your neck, you want to be using different consistencies of gel. So a lot of times I go with more of the medium or thinner gel because I don't really want those products to be seen. The lips is just a great example. You want to be using a thinner filler in your lips because you don't want to see the lumps and bumps, because thick fillers will present with that. If you think about it in the cheeks, it's thick, it's lumpy, it's going to give you that lift that we're looking for. In your lips, we only want volumization. We can use a thicker filler to create structure, but if you're only looking for plumping, then we only stick with a thinner filler that draws more water. Aside from a vascular occlusion, which is always the worst complication that scares everyone, another side effect is swelling, and that is to be expected. The swelling subsides over time, over the week, and then up to 2 weeks, usually your final result is seen at that time. Another question that I get asked frequently is how long will these fillers last? So with hyaluronic acid dermal filler, I did mention that they come in different consistencies. You have thin gels and then thick gels. So with the thinner the product, the less stability it has under the tissue. So therefore, it's not going to have a longevity of maybe a year. It might only have about 4 months to 6 months, depending if you get multiple layers done or multiple treatments done, if appropriate, then it can last a little bit longer, maybe up to a year. When you're talking about thicker fillers have a component to it that makes it more structural under the skin. With this being said, it can last anywhere up to a year and even longer in many patients. It really depends on the product used, and that's something that is very patient-specific, injector-specific, and that's something that I would definitely ask your injector before you get your treatment to know what type of product you're getting, as it is an implant, and it's just good to know for your own knowledge. So hopefully you learned a little bit more about what hyaluronic acid dermal filler can do for you. There are many treatment options. You just want to have those conversations with your injector, make sure you really understand you know, what you're getting, what your goals are, making sure that you're both aligned so that your results are exactly what you went in for. So if you found this video helpful, please don't forget to like, subscribe, and don't forget to comment below with any other questions you have or any other videos you'd like to see. I look forward to seeing you guys next time. Take care.